Well, welcome to the first in a series of webinars focused on the COVID-19 vaccination and back to school issues, especially as those issues affect marginalized communities around the state of California. These webinars are part of an effort called Love Your Neighbor and Get Vaccinated that is co-sponsored by the Markkula Center for Applied Ethics and Catholic Charities of Santa Clara County. I'm David DeCoste. I'm the Director of Religious and Catholic Ethics at the Markkula Center for Applied Ethics at Santa Clara University. And today we are so grateful to have with us Father Jon Pedigo, a priest of the Diocese of San Jose and the Director of Advocacy and Community Engagement at Catholic Charities of Santa Clara County. And Father Pedigo is very well known and has a very well-deserved reputation as a priest who has rolled up his sleeves for years and worked in marginalized communities around the San Jose Diocese and truly around California as well. So thank you so much for being with us, Father Jon. We're really just immensely grateful you could take the time to be with us. So we're just going to start with just a couple of slides to set the context of where we're at. And Amana, if you could share the first slide, please. There's our guest, Father Jon. And okay, so this is just basic context setting. This is the overall vaccination data for the United States. As you can see, 58.4% of the total population is vaccinated with at least one dose. Just over 50 is fully vaccinated. I want to note that's the total population, so inclusive of everyone. Children under 18 and younger are included in that number. All right, Amana, the next slide, please. And so this is the same numbers for the state of California. So California is doing a little better than the national average. 65.1% of our population in California has at least one dose, and 53.1% is fully vaccinated. So that gives us a little sense of the context of what we're dealing with here. And so I want to go over to Father Jon here, and we're talking about back to school issues and wondering if you can give us a sense of the communities, the men, the women, the communities that you all at Catholic Charities of Santa Clara County are working with, and in a sense, the people who are facing the challenges now as going back to school looms up.
Sure. Well, the big challenge for us is dealing with people that are already that had pre-existing economic and social conditions prior to the pandemic have been the hardest hit. So obviously, communities of color that have prior to the pandemic they didn't have adequate health care, wages were very low. They had lived in very crowded conditions, and they were many of the students living in the areas that we're serving, which is in Gilroy and primarily East Side San Jose and parts of downtown San Jose. The school performances are very low. So there are, and of course, people didn't have the technology access. They just didn't have the hardware, and they didn't have the broadband access. So when the pandemic hit, not a lot of folks were really ready for it, obviously. We didn't have the education infrastructure in place for distance learning. And so that was made up as you go through. So when you disrupt the education cycle for kids that are already behind academically, that are already facing all these social and economic factors of marginalization. I mean, a lot of people are unstably housed. Many people are unhoused. When you have these pieces, and when you disrupt that with a pandemic and then throw in this whole thing of distance learning where people didn't have the tablets, they don't have hotspots, they didn't have broadband, it immediately disadvantaged. So while some students continue to grow and move forward because they adapted very well to distance learning, a lot of the students where we're serving in these impacted communities did not have that same experience. So even though the public schools did an amazing job of, as quick as they could to get hotspots out to kids, as they get tablets out to kids so they can do this work, parents were still disengaged by the digital divide. Many of the parents in these communities were really separated. So that whole process of learning, it wasn't just about the distance learning of learning this material. It was also about the socialization of the learning experience. And so that was a big challenge. When you have economic problems and challenges in households, kids are already feeling that tension and fear about where they're going to live, where they're going to study, what's going to happen to my mom, what's going to happen to my dad. They have no home. I don't have my friends, the social safety net. So what you have is increased amount of anxiety as well. And so for us, as we look at this, it's mental health and academic performance have to be wedded together, have to be intertwined as we move forward into this coming year. But these are the things that just weren't, that we knew already, but when the pandemic came, it just stripped away everything that could protect us from the truth, and it just laid out the reality that we live in two different valleys, two different experiences, those who have and those who do not have. And then those who do not have are huge percentage, a majority of the people are the not haves. And this is where in academic performance and school experience, and now catching up to grade level experience, it's a really big challenge.
Jon, you've spoken of what's the kind of devastating consequences of the pandemic for these families, and I'll sort of focus on the children, in school and the kind of challenges they face. So, now as the new school year is coming, we have the rise of the Delta variant, and really causing increasing infections, increasing concern, and all of that. So, could you tell us, how is the Delta variant affecting these communities about which you have been discussing?
Well, in a very, very significant way, actually. Number one is that we're looking at 37% of the kids that are 12 to 18, only 30% of the Latino kids, who are the vast majority of extremely low and very low income families in Gilroy and Eastside San Jose, the hottest spots for COVID infection, highest morbidity rates, highest hospitalization rates. That continues now with also low vaccination rates. So this is a very significant issue for, when you have 37% of the folks that should be getting their vaccines are not getting their vaccines. That is a pretty significant piece there. I also want to kind of draw attention to the fact that these zip codes, or these, when you get really granular in the details, you can begin to start seeing where kids are having significant challenges already. I mean, you're looking at when you disaggregate the data, 36.5% of African American kids have gotten the vaccine, but compare that to Asian kids, API, that's 68.8%. White kids are 50.3%, and multi-race kids that are multi-race, it's only 23.8%. Latino kids, the younger kids, it's only 31.3% of the kids that have received vaccine. So it's very low. When as you get older, you have a few more percentile higher. But when you start to look at younger ages, 12 to 15, you're looking at pretty scary statistics. So what does that mean with the Delta variant? Well, we all know what that means is that if you are not vaccinated, it is a very deadly. It really truly is a deadly game of chance. And in other, and now they're seeing kids and people in Florida, a much younger cohort, are contracting the disease. And you look in here in California, who's getting it, younger people are getting it. And so and college age students are getting this. People that thought they were invulnerable, they're all getting it, and they're getting very sick. So we have to be very, very careful about, when we throw in the statistics, we have to disaggregate it and put it and plot it down in geographical locations. And you're going to start to see that there are areas and sectors of the city which are truly going to be very problematic. And that's where the school districts need the most help academically prior to the pandemic, certainly now in the recovery period, and now in the resurgence of a new variant. It's a triple whammy.
Brother John, you've mentioned the low percentages in terms of vaccination rates among children, or school-age children, 12 and up. Could you give us a sense of what you're hearing about why those rates are low? Are there issues of access? Are there issues of kind of myths and fears around the vaccines? Is there just wrong information people are dealing with? Why are those numbers where they are right now?
So, well, part of it can date how we did the rollout in the very beginning. This is my belief on this, is that when we were rolling this out, when the county was rolling out their strategy of getting vaccines out, we had been hearing from the community that we need something that's really in our community, immediately in our community. We need people that are, we need sites that are administered by folks that look like us, that speak our language, that know our culture. And what happened is that the county went to a mass kind of vaccination strategy. We're going to get a bunch of people vaccinated. Then they did a strategy where you just walk in, which is great, walk into a place, and then we'll go ahead and get you a vaccine, except that walking into a place took many, many hours. You get a little ticket, you stand in line at 5 a.m, you get in and you get your time when you can get vaccinated. Then then you're given a particular slot when your time comes up. That means you're losing an entire day of work. People that are losing their houses it was very, very hard for them to just sort of, take the time off. And vaccines were really limited to the county and in certain areas. And so it wasn't really as aggressive as we wanted it. The community members are saying, we need something now. We need something in our neighborhood. We need something by trusted entities are doing this. We need this, happening. And they didn't do that. So there was a bit of ground loss there. Now with this resurgence, a lot of the people, the majority of our families and the communities that we're serving get their help from clinics. And so they'll go to their clinic. The community clinics is where they're getting their major help, and they can get the shots there. What we're looking at is a number of kids we have to find out what's convenient for kids. Well, kids are going on to TikTok, they're going on to social media, and they're getting a lot of false information. So there's a lot of that misinformation, deliberate misinformation. Then we have a few Spanish language, social media folks, and WhatsApp and all that, and they're hearing bad information, false, just false information, misleading information, and so people are getting very confused. So we called for earlier the Latinos in COVID-19. We had asked and really demanded a strong communications commitment, from the county, from the state, that needs to go into our people so that happens. Now, they have done a pretty good job about that, but we're still not getting everybody connected. And that's really, truly unfortunate. We're just not getting as many people connected. So we're kind of already dealing with these difficulties. Our strategy now is what we call knocking and talking. We're going to go out to the neighborhoods, knock on the doors, talk to them, go out to promotoras in the neighborhoods, get trusted community leaders and peer-to-peer conversations, because what we need to do is socialize this vaccine process. And so we're working with Stanford Medical School. We're working with the county, Gardner Healthcare, and so Roots Community Services is also working in certain neighborhoods, and we're all kind of networking our conversations together to see how can we kind of really amplify this and get out there. But right now, low vaccine rates are a number of issues, and so if parents are doubters, the kids are most likely to be doubters. If kids are doubters and their parents are ambivalent or do not know enough about the vaccine, they don't have that crucial conversation to really encourage those kids to get the vaccine. Plus, we see the impact is that most of these families that are in these highly impacted areas are also essential workers. And we don't treat our essential workers really well at all. I mean, we give them lip service. And these are people that are on the front lines, serving us food, cleaning, They're out there doing all these jobs that we take for granted. They're an invisible but very visible workforce. And our lives can't continue on without having folks that are doing this kind of work, the everyday work. And those are the folks that are most vulnerable, and their kids are the ones that are most vulnerable. And they're also working 2 to 3 jobs. So when do you have time to take off to get vaccinated? You know, when do you have that time to have a conversation with your kids? When do you have the time to, you know, stand in line to get a vaccine? So these are all challenges that we have. And again, it's because the preconditions, the conditions prior to the pandemic have led to these challenges.
Brother John, have you heard, you know, 1 or 2 more common reasons not to get the vaccine that you could identify now and just respond to? Like, I'm thinking, I've heard people say there are concerns about fertility.
Yeah, I was going to say that's a big one.
Or maybe one other one that you could identify, just
Sure.
so people listening could sort of understand that that's, you know, we understand the concerns people have, but that there are really important reasons why that isn't a good argument, so to speak. So fertility, is there another one?
Yeah, a lot of things are around fertility. I'm trying to think of a couple other ones that you know, people talk about, you know, getting tracked, which is still bizarrely out there, that they're, you know, it's magnetic, is another one. So there's all these kinds of weird things that, you know, kids are hearing, and they're kind of doing these experiments, and, you know, oh, look, the key's standing on my head, or whatever this is, you know, like, so they're, those kinds of things are just demonstratively false. But kids are not really influenced by facts. They're influenced by their peers and by what's coming quickly on social media. These are, you know, these are kids that are not yet in high school. They're teens, they're in between kids, they're, you know, middle schoolers that are very tech savvy. They have quick, immediate access, and there already is a mistrust of authority. So they're going to kind of go with these kinds of crazy things. Now, that's what happens. Parents, there's a interesting thing that, you know, young males, working age males 18 to 55, also have particularly Latino men, have a lower rate of vaccine than their counterparts in other races, particularly AAPI, and in whites. Also, African American males fall into that same category. It could be one that they're hearing questions about how COVID may affect these vaccines are a test on you, and that it's just testing it on communities of color, and it's been done in the past, and they're doing it now. The vaccine was developed too quickly, and you just can't trust what they're doing. We're expendable, and look at what's happening. And so these are things that we're having to deal with, these issues that people will be saying these things. And history and point in fact is that there have been experiments done on African American persons and on Puerto Rican people, and these are things that happen about that they have been unethically experimented on. And so we have to say that is not happening, because you see that these other communities are doing it. These are your neighbors. Here in Silicon Valley, we have Asian folks living next door to Latino folks, and these Asian families are getting it, and they're not singling anybody out. That's something there. Some people are fearful that the information is going to be given to immigration services, and so we say it is not. They're taking this information to tell us when you're asked for this information, the demographic information. It is there to let the county know where the vectors of infection are. It's not to let the immigration customs and enforcement know where you are, so that we can go after you.
Father John, so in light of this, you know, the Delta variant challenge, in light of the vaccination rate challenge, you've identified all these reasons swirling out there, the importance of the socialization process. What would you say are the 1 to 2 to 3 key things that the world needs to know about the challenges the families you work with are facing as they think about sending their children back to school in the next weeks?
So number one is, get the vaccine. If your child is able to get vaccinated, and if you have a child that's able to get vaccinated, the whole family needs to be vaccinated, number one. Number two, you want to tell them is to continue to wear masks. So even though that you have you're fully vaccinated, you also can pass this virus on to others. In fact, I'm sequestered at home right now because one of my coworkers, we don't know if that person has tested or not, but we're in an abundance of caution. Those of us that had meetings with that person, we also got tested, not knowing what his results are, but we're just saying, look, we're going to take this abundance of caution. We're all going to be very, very careful about what this is. And so we're going to wait until we get our results. So you need to be really, really, get tested, be sure that you're tested. So again, it's number one is, get vaccinated. Number two is wear the mask all the time, wear the mask. And number three is be sure that you're getting tested. If you have a cold or, you come in contact with somebody that has it, don't be afraid to do this. It is better to be informed than to be ignorant. Know your status.
And Jen, you mentioned the significance of get vaccinated, wear a mask. And of course, these things have become sort of totemic in our society and these divisive, controversial things. So what would you say, like I'm imagining a scenario at schools around our area where the CDC has recommended teachers, students, visitors all wear masks, and you've got, a group or a person, let's say a teacher administrator who just refuses to wear a mask. Like, how would you respond to folks who are taking those really strong positions? I'm not going to wear a mask. I'm not going to get vaccinated. It's a violation of my personal choice. How would you respond to that?
Well, I think that it's your choice to do what you want to do, as long as it doesn't affect my well-being, my health, my life. And so your freedom goes as far as my safety and my well-being. And so this question of getting tested, this notion of just wearing your mask or not wearing your mask, that's not an option when you're in a situation that is truly, truly, truly dangerous to yourself and to others. And so your freedom is fine, but it doesn't extend into infringing on my right to a healthy life.
Jen, also, there's been a lot more discussion lately about things like vaccine mandates. The San Jose Unified School District has announced one for staff and faculty and others. Do you think of those are advisable for schools? Do you think those are problematic? What is your take?
No, I think that those are definitely advisable. I think that's a correct way to go, because again, using the same argument that, you're putting kids in a very vulnerable situation, and it's, kids need to learn. We don't have childcare, so parents need to go back to work. So we need to have these institutions of public education that are going to educate our kids and be able to allow parents to go about caring for the household. And so these are vital dimensions of the well-being and the economics of our society. An individual's decision to not wear a mask or to do about what they want to do, that's fine, but you can't do that at the expense of the community, and you can't do that at the expense of your neighbor who will definitely suffer from your choice. So you can't, there's certain things that we have to put certain safeguards, social safeguards with the gravity and protection of the law to ensure the well-being of the common good.
Father Jon, you're a Catholic priest, and we're not asking you to speak for the entire institution at all, but you also have a very rich background in theology. And I'm wondering if you might help us understand also a kind of controversy that's affected the Catholic community. And I think it's gone beyond it too, where some people have said, I cannot take a vaccine because the vaccines were developed using fetal cell lines derived from an aborted fetus. Therefore, it's impermissible for me to use a vaccine. However, someone like Pope Francis has said, in effect, everyone should get vaccinated. The vaccines are legitimate. Love your neighbor and get vaccinated.
Right.
Could you help us understand, like, what is going on with this dispute, and where does sort of the weight of Catholic teaching fall here?
Well, the way to Catholic teaching in our tradition is that the Holy Father has spoken, number one. So that's, we need to kind of obviously weigh that. So as a Catholic, you have to kind of hear what he's saying. Then you obviously look at the traditional teaching of around moral ethics, around the question of the sacredness of life. And so the deliberate taking of life to save another life is not ever permissible. But is that the case? You have to therefore ask that question. Was there a deliberate taking of life in the production of this, of the cells? And we say, well, look, the cells, the stem cells were not taken from these, like intentionally, that there was a fetus that was grown, and it was killed for the specific purpose of using that, using the cells from that fetus to develop this. So in a sense, you're saying there was no assembly line of murder happening so that you could have, that you could have this technology, because that's simply not the case. There was fetal cells that were used by fetuses that were already there. They were part of and it was done way early on in development, but it's not like they're not doing it for each batch. They're not using fetal cells for each batch. It was done as to taking those original fetal cells was part of the original development for all viruses. And so you're looking at all antiviral kind of medicine, that this is the part of the research. And so if that's the case, then you shouldn't have smallpox, and you can't be taking some of these other kind of modern medicines. And again, no one is using fetuses, for the sole purpose of terminating their life, just so their cells can be used for the production and for science. That is not the case. What's the overriding case, which Pope Francis is saying, is that it is regrettable that fetuses have died, and it is something that we mourn, and we oppose that. But it's sort of like in a sense, a transplant of their cellular material that went into the development of this. So therefore, what is then the greater good? The greater good that we're looking at is the protection of human life as it stands right now. And so that's the issue that we're looking at, it's for the common good. And so this science is really for the common good, and it's not about the promotion of evil, and it's not reliant on the promotion of evil either.
Father Jon, thank you. Our time is just about up. We've only got about a minute left here, but I wanted to ask you, as the communities you work with, and those men, women, and children are all going back to school, as teachers are, administrators, this is just an unprecedented school year and all. What are some words you have for all of these people about to launch out into this kind of sacred enterprise of education in these extremely trying circumstances, where people reasonably are really afraid, concerned,
sure,
hopeful, all of that?
Well, the words of Luke's gospel, do not be afraid. I think that's very, very important. Do not be afraid. The Lord goes before you always. This idea that we're walking in fear, this is exactly what those who are stirring up this doubt, they're trying to sow chaos and fear. And so the best thing to do is that we have sciences on our side that is helping us. There is a way to avoid getting killed. It's as simple as this: wear a mask and get vaccinated. Do not be afraid. Do those basic, super easy things, and you'll be fine.
Well, Father Jon Pedigo, thank you so much for your time being with us. Father Pedigo is the Director of Advocacy and Community Engagement at Catholic Charities of Santa Clara County, and for decades, really, a great community leader in the San Jose Catholic Diocese. So thank you so much for being with us. And I invite all those listening to stay with us. We have 3 more webinars on back to school issues. Our next one is Thursday at 11 a.m. Pacific with Dr. Brandy Odom Lucas, the principal of Verbum Day High School in Watts down in Los Angeles. And Dr. Odom Lucas is going to share with us how her community has responded to the pandemic and how they're thinking about getting back to school down at Verbum Day in LA. So thank you. This is David DeCoste from the Markkula Center for Applied Ethics at Santa Clara University with Father Jon Pedigo of Catholic Charities of Santa Clara County.
So long. Bye.